I'm Steve Levine with the Texas Medical Association. With me today are two members of the TMA Council on Healthcare Quality. We're here to talk about why adopting Choosing Wisely might be a wise choice for your practice. Dr. Frank Villamaria from Scott & White, Dr. Lisa Ehrlich from Houston, Texas. Why do you think Choosing Wisely is a wise choice for physicians today?
Well, I think it's a wise choice for physicians because it's a good choice for patients. It's good for patients. It helps physicians and patients with conversations about plans for care.
Do you think many physicians just give in when patients ask for a test or a treatment that the doctor thinks they really don't need?
Physicians know what is the right thing to do in most cases. I think that this document helps them to explain often those things, those decisions that he feels are right. Most of the time, in all cases, physicians know what's right or not, but the patients don't. They get bombarded by maybe TV ads, maybe ads from suppliers or drug companies saying a particular device or a particular drug is what they need, and it might not be. Also, I think patients sometimes feel that more care is better care, but that's not always true.
You know, here at TMA, we hear from physicians all the time that they're tired of the government, they're tired of insurance companies telling them what to do, telling you what not to do. Now, here come your specialty societies with a list of things to do or not to do. What makes them different? What makes your specialty societies different from everybody else who's sort of trying to insert themselves into the patient-physician operation?
Our specialty societies are made up of physicians, and so this is our own leadership. So we really feel like our specialty societies represent physicians better than these outside entities that do not have physician input or very limited input. So that's probably one of the biggest values.
And I'm an anesthesiologist. My specialty society has been putting out algorithms and practice guidelines for years, and they have been well researched. They're based on the best available evidence, and I'm confident in following them. I think it's good medicine, and I think we can kind of look at many of these recommendations in Choosing Wisely in the same way. They're put out by our specialty societies, some of our most respected physicians in our particular professions, and it's based on research and evidence, and it's good medicine.
Is it the physician's responsibility to help hold down the cost of care? Where does that enter into the picture after you determine what the quality answer is?
I think physicians definitely share in responsibility for the cost as it comes out to decision making. By using these tools, I think that we can actually help patients come to the same conclusion that actually impacts cost of testing that's not maybe necessary for the diagnosis, that may be putting that patient at risk, is not necessarily even just a cost issue. But certainly cost needs to play a part in all of that.
So if you're doing the right thing and not doing the wrong thing, then therefore whatever the cost is of what you're not doing is cost savings to the system, and it's the right thing to do.
Absolutely. And if we're not MRI testing, brain MRI testing every patient with a headache, when we do need that MRI, it's a resource that's available to us. Because physicians really, there's this thing that we call hunch or intuition, and it's really just experience. So sometimes I may have a patient with a headache that seems very straightforward, but I have a bad feeling about it. And I feel very comfortable, even with the Choosing Wisely recommendations, that if that's how I feel, then we should probably be doing that test. But that testing should probably be more available if we're less utilizing it in other patients that probably don't need that test.
I think if the physician feels fundamentally, like Lisa says, if they got a gestalt that I need this test, then it's the right thing to do. I think the Choosing Wisely helps the physician when they feel like the patient doesn't need the test, and that by not providing the tests are not going to affect the quality of care the patients get. In fact, they may be protecting them from harm in some cases.
Thank you both very much for coming in today. And if you have more questions about choosing wisely, go to the TMA website. It's www.texmed.org/choosingwisely. For the Texas Medical Association, I'm Steve Levine. Thank you very much.